In some patients with bunions, they have an additional deformity that they were born with in the middle of their foot. So that deformity is called metatarsus adductus. And all that means is that the first three metatarsals are angled inward rather than just the first metatarsal. And when that happens, which it is in probably 20% of patients, the correction has to include correction of all three of the metatarsals. Unfortunately, from a mechanical standpoint, it's just impossible to move the first metatarsal back into its correct three-dimensional position without moving 2 and 3 back into their respective normal positions. Now, it does change the operation a little bit because there's 2 extra metatarsals being moved, but the concepts of the procedure are exactly the same. The plating is exactly the same. Our comfort level and the reliability of the plating is the same whether we have to correct metatarsus adductus at all. The one thing that is different in our practice when we do have to correct 1, 2, and 3 for metatarsus adductus, we do ask the patients to stay off of their foot for a little bit longer. In our practice, we have them stay off of their foot for 2 to 3 weeks, rather than if we were correcting just the first metatarsal, which would be about a week off of their foot. So there is some difference. From a technical standpoint, from a correction standpoint, from a fixation standpoint, everything is exactly the same as we've become accustomed to, and we have great confidence in that. The only difference is we take a little bit longer to get the patient back onto their foot in the boot.